Idea of opening vaccinations for the 18 to 34-year-old group sooner than September the 1st. But we've yet to hear an official announcement. In the meantime, we've reported on several quiet vaccination sites, as you just saw. Governments received sharp criticism from medical experts who say communication is the key to getting people to vaccination sites. Wits University medical professor Francois Venter has found time in his very busy schedule to chat to us this morning about what sort of communication campaign the government should be working on and why it's important. Professor Venter, thank you so much for your time. You've come out quite strongly against government, saying not enough is being done to communicate about the virus and the jab. What would you like to see the government do?
So I think it's disingenuous of government to claim that it's hesitancy. You know, if a political party supporters, only 20% of them pitched up to vote, or a major corporation needed 20% of its customers to do something fundamental, such as maybe trading its car, you know, change its seatbelt. If only 20% of people after 4 months have pitched up, and you turned around and said, "Oh, it's hesitancy," you'd fire everybody involved. And this is the problem, is that there is a fundamental problem here, is the services do not suit people. I do not understand why we do not have door-to-door campaigns. Why are we not using the resources, the full government resources, to put up tents at taxi ranks, to take it to workplaces, to make it easier to get this vaccine? We are in an absolute disaster at the moment. We've vaccinated less than 20% of the eligible population, and a minority of the people over the age of 60 who are going to be the ones really taking the brunt of the fourth wave. Government really needs to pull finger and get out there. You know, arguments that we don't have a communications budget, that, you know, it's the fault of the population, is an easy way out.
Is this an indictment, Professor Venter, on the overall vaccination strategy, that from the very, very beginning, we didn't have a strategy put in place that could have foreseen things like this happening?
I do not want to underestimate that there are people within the Department of Health and there are people on the ground doing vaccinations who deserve a medal, you know, that are doing unbelievable work out there, particularly the coalface workers. But I think that the government has been way too passive in this, has not engaged the resources it needed, did not understand that what they were going to do is one of the biggest asks of the population in terms of just scale that would be required of the entire society. And again, it's like the HIV program. It's kind of been dumped on the Department of Health to sort it all out, while the rest of the society just gets on with it. We need to be mobilizing every man, woman, and child in this country at the moment to get the vaccination program back on track. Otherwise, we are just going to keep dropping the threshold, which will help make up some numbers. But honestly, we need to be vaccinating 10 60-year-old, well, we need to be vaccinating one 60-year-old for every 10 20-year-olds, because that's the group who are going to get sick when the fourth wave hits us.
So what is the key message then that government should actually be communicating, and what do they need to be doing on the ground, so that we don't get the same issue where in the beginning you open up to the 18 to 34-year-old age group, and those who are keen will come and they'll get the vaccines, and then it tapers off just a few weeks later?
I think there needs to be a more sustained mobilization of society. That I really do think that there's a role here for door-to-door campaigns, finding people where it suits them and offering the vaccines right there. I do not understand why we don't have massive vaccination sites at the malls, in the taxi ranks where people are congregating. I also don't understand why there isn't more of a concerted effort to make the vaccines available over the weekends at places which suit people. You know, as you say, it's the people who are willing to sit in the winter cold who are getting vaccinated at the moment. The general population, you know, is busy. It doesn't have time to find out where the vaccine sites. The communication of what is available and where is just really being poor. People need to be going to a place which is reliable, which is suitable for them. Take the services to the people, not the other way around. Don't sit back passively and say, "Oh, it's your fault for not coming to an openly available service."
Professor, what does the future of the vaccine race look like? We're already seeing countries in Europe, in the Western world, rushing for a third booster vaccine, and we're seeing them developing new vaccines for the variants that are coming. What does the future look like for that vaccine race, and what should government be doing now in order to make sure we don't end up in the same place that we are now 2 or 3 years from now when we don't have a strategy that's working?
To be fair, I think none of us has the crystal ball to be looking at this. Most of us involved in the vaccine field believe that the future does look like there's going to be repeated bouts of vaccination. We don't know if it's going to be for the general population or just for vulnerable groups. That we will find out probably before the end of this year. But government needs to be thinking about this, is how do we recalibrate our society to have to do this again and again, possibly every couple of years, where we have to find the over 60-year-olds, the diabetics, the people with HIV, and offer this vaccine the way that suits them. It doesn't suit the health services, but actually suits the patients who need to be accessing it. So there needs to be a real focus on this. The third wave, came along after 2 waves, and government shrugged its shoulders, particularly in Gauteng, and said, oh, we didn't expect this. After 2 waves where everyone was telling them the third wave was coming, didn't make provision for the healthcare services. We knew the vaccine program was coming, and it seems like, again, government hasn't made provision for this. So they need to be thinking about what resources are going to be needed, what deployment of government resources of the private sector, of the workplace, are going to be required for repeated bouts of vaccination in the future. But the first absolute priority is to get as many people vaccinated before November as humanly possible.
Professor Venter, thank you so much for your time. Getting the strategy right now, like you're saying, would definitely help in the future if we need to keep doing this year after year after year. Wits University medical professor Francois Venter joining us this morning to talk about the vaccination drive in South Africa.